next question is, can we bill for assessment of respiratory function? And the person that submitted this question, they saw a reference to the item number, which is 11503, in a MBS review task force document. Now, this is actually there's a bit of a history with this item number. So when that report was published back in 2017, that was at a time when the MBS review task force was looking at intensive care claiming and intensive care item numbers. And it was this item number was mentioned as one of the most commonly co-claimed, although even at that only 1 or 2% of the time, but one of the most commonly co-claimed item numbers with the daily management fees, which means that a lot of people that have gone through intensive care have had this item number claimed. This item number, I think, was always designed to be used by respiratory physicians for respiratory function testing in a respiratory laboratory setting, not in a hospital admitted intensive care setting. And the wording of the item number has actually along the years changed to reflect that. So whereas in the past this wasn't in there, if you look at the MBS definition of that item now, it has a descriptor which clearly says that it's performed in a respiratory laboratory, which means that this is not something that you can use for intensive care services, although the generic item descriptor does say that it can be used for any means of measuring airway or pulmonary resistance. So people used this when somebody was on a ventilator and they were sort of inferring pulmonary resistance measures by the numbers that the ventilators were generating. Now the item numbers and the item description very clearly defines where this can be used, and this is definitely not an item number that can be claimed in intensive care.